there's a lot of medical and dental articles and research that's been done about the effects of periodontal disease in the rest of the body. And it's a very well-known fact that overall inflammation, chronic inflammation in the body is not a good thing. Right? So when we get injured, the body response is to create an increase of blood flow and bring in cells that help heal and fight off infection. That type of acute inflammation is meant to help the body and help it heal. The problem is when that kind of inflammation sticks around, it tends to kill and harm other cells around it. So periodontal disease is a chronic condition of gum infection. It starts out by a little infection, a little redness in the gums, and as that continues, the gums, the blood vessels around the gums become more dilated and actually start getting a communication from the outside world because the body's trying to fight off the bacteria. So the gums then allow, because they're unhealthy, because they no longer are sealed up and form a barrier, there's a breach in the barrier and allows bacteria into the bloodstream and then able to travel throughout the rest of the body. As that bacteria travels, inflammation increases. Both of those things affect systemic health. The most known, most notable, and most documented are the effects on health, heart health, and secondly, diabetics. So from a diabetic standpoint, it's kind of a scary proposition because diabetics are more prone to inflammation, therefore more prone to periodontal disease. But an increase in periodontal disease makes the diabetes less controllable. And so before long, many of our diabetic patients find themselves in a spiral headed downward of poor health, all because they're not stopping the bacteria in the bloodstream. And so to stop that cycle, getting the gums clean and healthy prevents bacteria, reduces inflammation, therefore their diabetes becomes more controllable, which then helps the inflammation, which makes periodontal disease more controllable, and then you start spiraling upwards towards health. But it's extremely, extremely important. Another area of note when we're talking about periodontal health and gingival health is that of pregnant mothers. So there's a lot of research that's come out recently and concern about preterm or low birth weight babies. And very definitive studies have shown that gum disease and lack of periodontal health is very directly linked to preterm babies or low birth weight babies. It's extremely important for a pregnant lady to stay current and even very diligent on keeping her gums clean. And a big part of that reason is we need to cut down the amount of bacteria that's in the bloodstream. Anything that's in the mother's blood goes through the placenta and enters into the baby. Therefore, it's extremely important to keep that bacteria load down for a healthy fetus and healthy baby. As a side note, during pregnancy, the hormone changes in a woman actually cause the gums to become more pliable, more soft, which happens throughout the body. And it's a normal response to tissues preparing to give birth to the baby. But that sets up a situation that that bacteria have a better chance of getting in. So extremely important for pregnant mothers to stay on top of their hygiene. In my case, my estimation, in my family members, when my wife was pregnant, I wanted her in to get it clean every couple of months because it's just not worth the risk that can happen to the fetus. But if we can eliminate that bacterial load, we eliminate a lot of potential problems coming down the road through the baby. So another big thing that we're concerned about is making sure that our expectant mothers are taken care of and are taking care of their gingival health. Not only the dental cleaning, but we also talk to them about a little bit need to change their technique in their flossing adding adjuncts like fluoridated rinses, things like that will also help with the inflammation. Just make sure we have a nice healthy pregnancy and we get healthy babies too.